Welcome everyone. We're going to wait just a couple of minutes for everybody to come into the webinar. And thank you for joining us today. We'll wait another minute or so until we see everybody kind of finishing signing in here. Okay, it's starting to slow down. All right, so welcome everybody. Today I'm really excited that we're going to be talking about bilingualism and selective mutism for professionals. Some of you may have joined us last week where we had a similar panel for parents, but I, again, am very excited because we have a wonderful panel of experts today. So first we have Sabine Laerum. She's a speech and language therapist, a certified PCIT-SM therapist, a patholinguist and MA of Linguistics and Rhetoric. She is German and Swiss and currently is located in Switzerland, but also spent 5 years living in the US. Sabine is specialized in the treatment of selective mutism. And as a therapist, she works with children, their families, and schools. Often her clients are bilingual or even multilingual. She regularly leads workshops about selective mutism for teachers, therapists, and parents, and additionally has teaching assignments at the German University of Potsdam and Giessen, where she trains students of speech and language therapy, as well as prospective child and adolescent psychotherapists. So we're really excited to have you, Sabine. Thanks for joining us. We also have Dr. Nelly Tong, who's an educational psychologist working with an NGO in Hong Kong. Her work includes conducting psychological assessments to preschoolers as well as school-age children, conducting parent training as well as teacher training. Over the past 3 years, Nelly has been focusing on developing local preschool social emotional learning, a learning curriculum for preschoolers. She completed her 1-year PCIT-SM treatment with Dr. Kurtz in March 2021. And has been providing treatment services for several SM cases. And last but not least, we have Ms. Eileen Herrera, who's a licensed mental health counselor and the director of the Selective Mutism program for the MINT Anxiety program at Florida International University. She supervises student trainees and provides weekly and intensive treatment in English and Spanish for children and teens with anxiety. And I'm also lucky to say that I get to work with her on a regular basis there. And I'm Dr. Jamie Fern, president of the Selective Mutism Association, and I'm very excited that I get to help moderate this panel today. So just a couple of things to note for our talk today. This webinar was made possible thanks to a generous grant from the Gordon and Marilyn Macklin Foundations. We want to thank them. Some helpful info. So this webinar is being recorded and it will be available on our YouTube channel within 24 to 48 hours, as well as a link to the recording will be sent out to every registrant early next week. Please feel free to ask questions in the Q&A box or that question box. So if you prefer to remain anonymous to the group of attendees, please click the anonymous button in the question box. We will try to incorporate these questions throughout the discussion today. If you have comments for the entire audience, please, you can do so in the chat box, but please try to use the question box. And please register today for our next webinar, which is medications as part of an SM treatment plan, who, what, when, why, how, and how long, which is a free webinar held by Dr. Stephen Kurtz on Wednesday, May 5th. So we look forward to this webinar as well, and that is geared more towards parents and caretakers, but anyone can join. So let me come here. Share. Okay. So, all right. So Welcome everybody. So what I wanted to first do is just kind of discuss what selective mutism is. I'm sure most of you who are kind of involved and are attending today know what selective mutism is, but it is an anxiety disorder in which children or adolescents, even adults, have difficulty speaking in social situations where they may be able to speak in other social situations just fine. So typically what that often means is in the school setting or in their occupational setting, they may have a failure and inability to speak, whereas at home, sometimes they're described as chatterboxes. They talk frequently and typically in their comfortable environments. So in terms of bilingual children and multilingual children, what we do tend to find is that the prevalence is somewhat higher. We were discussing before we kind of signed on here that the prevalence rates really vary depending upon who is conducting the research as well as what population is being assessed. So anywhere between 2 to 30, two times up to almost 30% greater rates of children who are multilingual to monolingual children are showing rates of selective mutism. So we're seeing kind of this vast kind of range of rates here. So it's a little hard to answer sometimes these questions when we've got people coming from multiple countries, multiple areas of the world, because it really can vary. So we do know, however, that when children are acquiring a new language, there is a silent period. So we know that there is the standard kind of anywhere between 3 and 6 months of time in which they are going to not be using that language that they're learning as frequently because it's still new to them. They don't know it as well. They're uncomfortable with it still. And so we expect that. So we're not going to be diagnosing selective mutism if they're still within that window of time when they're learning that new language. So we're really kind of talking about sort of after that period of time, or when you're seeing that they kind of have become selectively mute also in their primary language. So it's kind of morphed into the other language as well. So we did have a number of people write in with questions and some things that we know are of interest to a lot of you who are attending today. So we can kind of get right to it. And again, you can always ask your questions in the question box. So first, just to start, and I'll put it out to all of you, but how do you guys feel like your culture kind of influences the diagnosis of SM? How does it differ, do you feel like? Because you're all coming from different places, different backgrounds. You can jump in. How do you feel like it influences you?
Perhaps let me start first. Thanks for having me to this webinar. So I come from Hong Kong. So in Hong Kong, SM, the diagnosis and treatment is not so well known in Hong Kong. So the culture of Hong Kong is very competitive and the school is very demanding academically. So it is quite easy for teachers or parents to spot kids out when they're not speaking. And the culture of Hong Kong, sometimes we also put a lot of emphasis on compliance. So when an adult or an authority figure asks you a question, they usually, expect the kid to respond right away. So the acceptance towards like silent, like mute, is not that high, I would say. So, but the public education or the awareness of SM is not quite high right now. So I would expect if we do more public education campaign on this, I guess teachers and parents will be very happy and very willing to refer for an assessment. And I also think that the culture of Hong Kong will affect more, shall I say negatively impact, but affect more on the treatment side. Maybe we can discuss more later on.
Mm-hmm. Great. How about for you, Sabine?
This is so interesting because in Switzerland and Germany, it's kind of the opposite. It's very well accepted that children are not speaking up when they're really young, especially during the onset period between 2, 3, 4 years old. It's totally perfectly fine if a child does not respond. And we see usually that people wait it out because of this. They just expect the child to be very shy, which happens worldwide, I guess. But the people don't feel a lot of pressure to change things because they mistake the behavior of selective mutism as a character trait. And then the pediatricians usually or often tend to recommend to wait it out. And so we have a really late start to assessment and diagnostic often, unfortunately. But in general, I would say from a point of view as a therapist, I don't do different things than other therapists in other countries. I will assess and diagnose just with different measurements, maybe I'm using different questionnaires because they are originally created in German, so you might not have immediate access to it. I put together a document with a couple of questionnaires that we're going to share with you all. But maybe there's something helpful in there for you. Yeah, so, but in general, I do the SM bot, I use the SNAP, I use the SCARED, those kind of assessment measures, just like you.
Great, great. Yeah, that's probably very interesting thinking about how that kind of delays things, just that general tendency to not have them kind of.
Yeah, and also the pressure is not so high on parents to act on it, although they have I'm sure everybody will agree, parents really have such a good gut feeling about something's off here. And they kind of know, but they will also get criticized for that a lot. And then people will say, don't be American. Don't overdo it. Don't make something, like focus too much on this, on the silent behavior being not okay, while your child just needs time to develop. So.
Interesting. Wow.
Yeah.
Okay. How about for you, Eileen? What do you think in terms of how like the culture might impact how you diagnose or how you work with kids?
Yeah, so I feel similar to what Sabine said, that my treatment and diagnosis is similar regardless of the population. But one thing that I think influences me is coming from a bilingual home myself. I can understand the value of that and wanting to expose the family to all these different languages and wanting to keep that in mind in treatment and making sure that I like adequately prepare the child or the teen to speak in those languages and have that success and kind of meet them where what the family wants.
Yeah, I think that, that leads to another question that we got several times, kind of, we've had several parents where they say they feel it's their fault and, because they're still trying to encourage that native language. They're encouraging that native language, and should they continue to do that? Should they just stop and speak the language that the child is speaking in school? So as therapists, how do you kind of deal with that? What do you encourage for families to do? And what would you encourage these other professionals to do when working with these families? Eileen, do you want to go, since you were kind of talking about that? Yeah,
happy to jump in. So typically what I recommend is that, of course, continue to speak the native language at home. Usually they might not have that exposure to that language outside because at school they might be, for instance, like speaking English or whatever the primary language in the school is. So there's obviously a lot of value in continuing to speak their native language in the home, but also talking about how to encourage some time of the day to speak English or whatever the language is in the school that they're having difficulty in, whether it's, a playtime that's like dedicated to speaking in English or the secondary language, or, maybe reading a book at bedtime and just starting to like increase the exposure to that other language so that they're also getting some practice with the people that they're comfortable with, to kind of start off and build that comfort. And then hopefully over time can start branching out to speaking that language with others.
Sabine and Nelly, do you guys kind of feel similarly?
Yeah, and I almost often or always have this discussion with parents that they feel bad about raising their child with more than one languages at one point, and they feel kind of guilty, and they ask themselves if they did something wrong, or yeah. So it's really kind of a burden suddenly, while it's such it's such a use asset to grow up with more than one languages, and more importantly, it's always two cultures, three cultures. It's the whole package. It's not only the language, and this is such an asset. And I encourage the parents to, just like you, to speak their native language, to live their culture, to bring it into the school, to share with people, to be really open about it, because often the families, or the kids at least, they experience a cultural gap, and that reflects in the language then. But I think it's really, really important to have lots of input in your native language, which often is the minority language. Let's say some family speaks Polish at home, and majority language is English. It's often the case that people stick to one parent, one language system, which means they always would talk Polish to the kid. That excludes all the other communication partners who don't speak Polish. And also the kid and the parents stay inside their little private bubble, also in public or in school. And both of this will likely or can entrench the idea of, I'm able to talk in this setting or with these people, but in this setting I can't. Mm-hmm. And to slowly help parents to speak the majority language with their children when they're in public or in school is a really big step for the parents, because they feel they lose, the children will lose their ability to speak the language properly. And that's a tough point for most families. And it's good for them to know that usually at age 4, 5, 6, there comes a lot of lexicon addition, basically, but grammar is there, all the bootstrapping you needed to learn the basics of the language, it's done. So that often helps.
Yeah. How about for you, Nelly? Anything different?
Yeah, so in Hong Kong, so we have some immigrants from mainland China. So the language system is a little bit different. So in mainland China, they mainly speak in Mandarin, which is 普通话. But in Hong Kong, we speak in Cantonese or English. So, and you know, in Hong Kong, the culture is quite competitive. We ask the parents to use more Cantonese or English. They tend to make it like a training, like drilling a kid like to speak vocabulary. So for SM kid, I think there's always a psychological side of it. So parent being a safe figure, like at home, they have time to have fun with the kid and to give a lot of labeled praise. This is something that our parents need to work on a lot, because they tend to be, quite demanding on the performance side. So I would encourage them to use their native language, but to use more labeled praise to make the kid feel that they have a sense of competence. But since I'm also an educational psychologist, I also work with the school. So I will invite interested school personnel to work with me to be the key worker at school. So the second language could be, work with the personnel at school instead of, work with parents. Parents could have fun and safe and competence.
Yeah. Do you, so a couple questions that have been coming in through the question box here. Do you what do you guys typically recommend in terms of kind of these dual language programs or kind of the full language immersion programs, specifically when you're working with a family who has a child who has SM? Whether that's a Chinese immersion program, a Spanish immersion program, or kind of those dual language programs. Any specific recommendations?
So I find that a very great and interesting and important question. And I think the system in the US is a little different. We don't necessarily have those immersion programs, but I'm aware that they exist. And so we have some private schools that might offer that. And I would always recommend parents to not send them into an immersion program if it's only about being, like learning a second language as a tool to be even more successful in a world that expects so much from the children. If it's only about that, if it's only about being more and more proficient and being able to succeed in 5 languages or more, then I think it just puts more pressure on it. But those parents are really rare. Usually there is some context, like Canadian families who are living in a bilingual country. Or in Switzerland, we have 4 languages that are like the official languages. So we have lots of bilingual couples. So you want to make sure your child speaks Italian, because otherwise it's hard to connect with the rest of the family. So that is a different issue. I would not recommend to stay out of immersion programs only because your child has SM, because that kind of is sad and is not necessary. But if you plan on putting your child in an immersion program, I would make sure the school is really open and on board to work with you and the therapist and the parents and with everybody, and go for a team approach and make sure that this child is specifically accommodated to phase in easily in the new setting, because it will be an extra challenge. It will be more anxiety provoking for those children, very likely.
Yeah, I completely agree with Sabine, and just kind of to add on to what she said, I think, with the team approach and the support, just thinking that when developing goals for what participation is going to look like in the school, it would make sense, like when we're building a fear ladder and things like that, that you want to start the verbal participation in the language that they feel most comfortable in. So for instance, if they're in an English-Spanish dual language program, if they feel more comfortable in Spanish, it makes sense that your goals first would target their participation more in the Spanish classes. And once there's success there, then kind of starting to shift and move on to, the language that they have more difficulty in.
I would say the similar thing. I don't want to repeat like what Sabine and Ellen has just said. So taking a baby step in, getting comfortable with the new language or in a new environment is very important, because in Hong Kong, all the schools are dual language. I would say it's both language, it's both English and Cantonese, and sometimes even Mandarin and learning. So once a kid entering into a school system, I would say is multilingual, because some of the schools even have French program and German program and Japanese. So you can see the kid is taking like Mandarin class, Cantonese as usual, English, and maybe one Japanese. So there is switching languages within maybe 4 hours. So it's not about which program you enroll in, it's about whether you can find a keyword code that you can work with to set small goals. Yeah,
that's a lot. Yeah, I think, are there particular kind of people in the school that you have found, or kind of in the educational settings, whether that's speech and language pathologists or other key workers, that you find who have been most helpful for those children who have been identified as being bilingual. I know sometimes we're lucky down here in Miami that you've got the teacher who speaks both Spanish and English, but are there other kind of roles that you have found that are particularly helpful?
Well, in my experience, speech and language therapists are really, really helpful. If you have one at school in Germany, you don't have speech and language therapist at school. It's a different system. In Switzerland, we have that. In America, you have that. That's great. If you don't have a key worker like a speech therapist, I'm able to include parents in the work and use them as like fade in over their native language person. That's helpful too. And just make sure that the kid is comfortable in the native language and take it from there.
What somebody asked sort of what steps would you encourage kind of that SLP to do kind of in that school setting? How can you have them help?
Definitely with a with a team approach. Learn a lot about selective mutism first before you meet the kid. Know how to start on the right foot, fade yourself in. Don't just assume the child will eventually talk, but follow the specific steps of fading in yourself. So you just end up as a talking person. It's a person who the child can talk to. And make sure that you start in a one-on-one setting, ideally even at home. Do a home visit, take it from there, include the parents or another person the kid can talk to, then slowly fade in more people step by step, and change the places accordingly slow. Don't just expect the child to still talk to you in the classroom because she talked in the speech and language therapy setting in your room. So just follow a slow and mini step program and get knowledgeable about PCIT-SM. Sign up for the Selective Mutism Learning University that Stephen Kurtz put in the internet as a free resource.
Yeah, a great free resource, yeah. Thank you, Eileen, Nelly, anything to add in terms of like who to seek out or to any additional steps? I think kind of in particular, how do you incorporate the language component, right? So are you encouraging SLPs to start in, or any key worker really, or any person that you're working with to start kind of in that language that they're most comfortable with, in the language that's happening in the school most often? How would you advise most of these professionals to work with these children?
In Hong Kong, I work mostly with the social worker. And I mostly work with the preschools. So in a preschool right now, we have one social worker based in a KG, a preschool. So she has the responsibility of taking up the cases. So usually we start off by, using the language that a kid feel most comfortable with. Could be Mandarin or Cantonese. And in my experience, one kid surprised me that one day our treatment is in Cantonese, and one day he can be a little assistant to an English teacher and to do like demonstration of vocabulary. So along with the treatment, sometimes the kid would generalize the brave muscle to different figures beyond the treatment sessions.
Yeah, similar. Yeah, I love that too. similarly to what Sabine and Nelly mentioned, I often start or recommend they start in the language that they feel most comfortable in, whether that means using the parents and the people that they feel most comfortable with, or if I speak the language in Spanish, I'm happy to facilitate that and go to the school and hopefully kind of bridge that gap where I might start off the fade in speaking to the child in Spanish and they can answer me in Spanish, but trying to kind of fade in English into what we talk about. Maybe they can say it in Spanish first to me, and then I kind of prompt them to say it again in English, and then hopefully get them feeling comfortable speaking in English with me, and then kind of more easily be able to fade in the teacher or any kind of key worker that is going to be working with the child.
So we did just put the that SM University link, excuse me, the SM University link into the chat function so that if anybody needs to take that, you can. Do you think, so we had a question about still recommending the school team approach if SM also is kind of co-occurring with a learning disability. So I know my answer, but just was curious about what you guys would recommend. I'm going to say yes. Like the team approach, I think goes.
Yeah, I'm wondering why not.
Yeah, yeah.
Well, because most of the children do come with some comorbid condition.
Mm-hmm.
Yeah, team approach is always a very, very helpful, great way to approach selective mutism and probably all disorders.
Exactly. Yeah. That team approach, as many people as you can get, I think, are, anyone who's willing to help, I find is like, I'll take them, like.
Yeah, me too. And if you look at if you think about it, so if a therapist works, let's say 45 minutes a week with a child, that's about 0.75% of the time the child is awake. Mm-hmm. You're getting nowhere.
Yeah.
So.
Yeah, exactly. Are there any tips for identifying whether a student is incorrectly identified as SM? So someone wrote, I have a bilingual student who recently got a diagnosis from a doctor as being SM and having social. However, information I received from the parents is that even in their native language, the student typically only responds by imitating others.
Does that, I would wonder if the conversation or the communication with the parents at home without any strangers being present would also be only like echoing what
right.
their phrases and their words.
Yeah.
It's hard to
I would want more
specific.
Yeah, I would want more observation, more maybe videos or things like that of like what the child's communication looks like in their most comfortable with either their parents, like at the home, no other kind of outside influences that might be influencing how they communicate and kind of going from there.
Right, and still if the child would, it could be both, it could be selective mutism and something else.
Yes.
Yeah,
but I think those behavioral observations and seeing them speaking in that native language, in the most comfortable language with their most comfortable people is kind of that best way to go. Yeah. Okay. Okay. Any strategies to encourage class participation, like kind of within the treatment? Maybe let's expand a little bit on the treatment. I know we said kind of fading in, using some baby steps, starting with the most comfortable language. Kind of how do we then, I know, Eileen, you were starting to say you kind of have them do it in their native language and then copy into the kind of the new language. How would you kind of go further from there into further class participation, especially if you may have a teacher who doesn't know that other language? Any recommendations on that?
I would say it largely depends on where the child is at a given moment, like in treatment and what their successes have been so far. But for instance, if they're kind of still at the place where they rather answer first in Spanish, sometimes what I'll do is, if we're starting to practice in English, kind of prepare, cards or questions. And so like there's lots of preparation of what exactly the teacher is going to ask the child. And then, we could practice in session those answers in English. So it seems a little more rote and like they know exactly what they need to say versus, a spontaneous question that a teacher might ask and they have to kind of translate and might have that difficulty or that anxiety to answer, even if it's one-to-one. So I usually start with more pre-planned questions and answers that they already kind of know what exactly to say, even if it's in English.
Are we talking about the whole class engagement, like answering questions in front of like 30 students? I would say we would practice like using maybe the second language in a small group first, like with other peers. So some of the kids, they have no problem. At some time point during the treatment, some kids will have no problem answering teacher's question one-on-one, but they will have problem answering questions in the class because of other peers are present. Because in Hong Kong, we have maybe class size maybe 30 or 20. So I would start off by having maybe peer buddies group, maybe 2, taking very baby step. We don't want to flood the child with any surprises so building up the number of peer buddies. And then if the kid is quite comfortable like speaking in front of maybe 5 or 6 kids, I would just like Eileen practice. I will try to script the question and prepare the kid for the question in the class and try the same question during the lesson. So very transparent, no surprise, step by step.
I also found it very helpful when I'm doing intensive. So I go to school with the kid for a couple of days. And if the teachers are open for it, they let me teach a portion of the day, kind of teach. So I have the chance to model my behavior to the teacher, but also the kid can already talk to me in front of the group. So I do games like Hangman and include the child, or I start with prompting the whole group non-verbally and then take it from there, asking forced choice question like scaffolding speech, like probably all of you know already how to do this. That is really helpful because then the teachers can pick up on it. And the child already had a successful speech situation in the big group. I usually have to start slow, like Nelly said, with a smaller group settings first, of course. But then if you have some key worker or you can go by yourself and do this is really a great game changer.
Yeah, great, thank you. Maybe you can expand a little bit on, we had somebody kind of asking about the split in roles of somebody, if you've got an SLP, how do they help beyond maybe a counselor who's doing CBT with a child who has SM, maybe in that school setting? How can they, sure, go ahead, Sabine.
Or
yeah,
is that guided towards me? No.
It wasn't specifically to you, just
okay.
asking, yeah. Any thoughts on that? Specifically for kids who are learning, who have dual, like who are bilingual
Yeah, maybe I just give my 2 cents.
Yeah, please.
I mean, those kids often have some speech and language issues additionally. So that is really important to always also be treated. And I think it's a great combination to have, for those issues, have a speech and language therapist present at school, plus somebody who treats the selective mutism.
Do you have a recommendation for doing one first before the other, or doing it simultaneously, especially for kids who have multiple languages?
I think both is pressing. I would always do it simultaneously, if possible. You don't want to waste time on either of the disorders. Of course, the kid needs to be able to talk freely to the speech and language therapist first. So that means usually that some first treatment steps will be geared towards more the selective mutism, because if the kid doesn't talk, then you're stuck with working receptively with the child, and that's just not enough.
Yeah. Do you agree, Eileen?
Yeah, I was going to mention that I've had moments where I need to facilitate a fade in with someone that's going to work with the child, whether that's an occupational therapist, a speech language therapist, any kind of additional counselor or key worker that's going to work with the child. I would help facilitate that fade in so that they have success in speaking to them and then can continue on their own goals.
So we had kind of talked about kind of recommending some, practice in that other language, right, in the home with the parents, especially because it's most comfortable there. What do you do if the parents refuse to do that practice? Like they just don't want to do that. What do you recommend?
I never had that.
Yeah.
I really, honestly, I'd never experienced that, but sometimes you don't have a shared language with the parents. That's difficult then, because they might not speak English or German. That is kind of, then they can't practice to a huge extent. I still would try to motivate them to do their very best with the little they have. And yeah, I would do that, because it's really important to model that they also try to learn, and they expose themselves to difficult situations.
Yeah, I would just add that it's definitely a tricky situation to tackle. I think, being respectful of their desires to, use their like, if they do speak the other language as well, and they're just deciding that they at home want to speak the native language, I think I want to be respectful of that, but then also talk to them, just give them a little bit of just psychoeducation about SM, and just the expectation that they would need to be learning and speaking a language only at school, where I'm sure that they know they're not comfortable at school. They're visibly anxious all day, and just kind of talking to them about how would you feel, and how would your ability to learn a language and practice it, how would that be affected by this kind of high level of anxiety that you're feeling at school? And hopefully getting parents to think a little bit more about that, and just, them seeing the value of give your child the chance to start learning this language and speak it and get with the person that they're most comfortable with, which is you. And hopefully that could be something they might be open to over time, even if it's just, a brief period of, not a huge portion of their day, but even just a small opportunity to practice, or if there's maybe extended family members that would be willing to help.
The situation in Hong Kong, parents are very busy, they're working all day. And some of the parents, they could be very educated, but at the same time, they think treatment is something should be handed over to a therapist. I have a kid, I work mainly with a domestic helper who is a Filipino. So, because every day, domestic helpers spend most of the time with the kid because both of the parents needs to work outside. So that would be my key worker at home. And I also do regular update on the progress with the parents. But during the specific time, I will make more phone calls to the parents to urge them to do the CDI with the kid, which the part that parents can play with the kid and give a lot of label praise. That is after long vacation. Yeah, the kid need to readjust to the school environment and school routine. So I urge them to do like maybe 5 minutes, maybe 3 days in a row. Yeah, just fingers crossed they would do it. But a lot of regular updates, the parents, when they see some progress, they are more motivated to do. Yeah.
Yeah, it's a great suggestion. Yeah, I like that. How do you, and this question just came in through the chat, how do you explain to the school that the child doesn't need, at least, so for us here in the States, we have like ELL, so like we have English language learning programs, and that's specifically for kids who come in speaking a different language than English, and so they're put into this class. And so sometimes these kids are then put into that class. How do you explain to the school that they don't need that ELL class because they're actually fluent in both languages? But does that make sense? Any recommendations on that?
I guess I would just say wanting to know for sure how fluent they are, whether it's some kind of like testing or something that could demonstrate that they are ready to be in an English class. It's just, it's the SM that might be potentially getting in the way of them being able to demonstrate that they speak English. And then I would likely recommend sort of a slow transition into a full regular English speaking course so that they still have some exposure, some practice in Spanish or whatever language that they're most comfortable in. So they have that, but then hopefully starting to kind of slowly transition to an English class and start getting that exposure just more incrementally versus kind of like a transition right away where they might all of a sudden not be participating at all while in that ELL class they might have been participating. So just to kind of not affect it so drastically, maybe do a slow incremental approach to that.
And for the school, if they feel it's a matter of language, I would really encourage them to meet and learn a little bit more about selective mutism as not being a language issue, but as an anxiety disorder, and also show them videos of the child speaking fluently English, so they can understand that they basically waste a very precious spot for another child who really doesn't talk English.
Mm-hmm. Mm-hmm. Yeah, it's a good point. So we had a question come through about assessment in terms of kind of assessing the language in terms of if they are not necessarily proficient in the additional language. And so how do you assess them? Would you kind of rely more on kind of receptive additional language tasks and not place the demands on the expressive language tasks? Or any specific tips on how to assess them in that way? And hopefully Lauren, I got your question appropriately expressed. It's also in the chat.
So I would, if the child doesn't talk to you yet, it's impossible to assess the expressive speech. You still could at least look at videos that their parents did at home, took at home, and get a rough idea, at least for starters. And then make sure the child can talk to you, and then do proper assessment with standardized tests in both languages, if possible. Yeah, ideally involve a translator or the parents, help them to help assess in a correct manner.
Eileen, or Nelly, any additional thoughts on that? I know Evelyn Klein and Sharon Armstrong did this study where they trained parents to criteria and to administer the tests, and that would be amazing if we could all do that and have them do that and give those tests, because then hopefully we'd be able to get those to get a real accurate account of what their abilities are. Let's see, so we have about 8 minutes left, so we can probably get to another few questions here. Any specific strategies to try for a child who's now not using the home language with extended family members? They're happy speaking within the English speaking education setting, which they weren't previously, but now it sounds like they're not using that native language with those extended family members. So it's like they made gains in one area, but then kind of dropped off in the other area. Any recommendations for that? Does that question make sense?
Yeah. I've seen it before. So I think that just like how you would tackle any goal, I think that thinking of, building a fear ladder, kind of coming up with incremental steps to start the exposure back again of speaking that native language. Hopefully parents can be involved and kind of shaping from there. It just sounds like they just need more practice in that area. So kind of just shifting focus, just depending on what becomes most important to practice at a given moment. But then that means just because of that, it becomes important to keep in mind that they should maintain practice in both languages continuously, so it doesn't kind of drop off again in the future.
And likely the issue has to do more with anxiety levels that for some reason rose and not with being bilingual.
Okay, just looking at my time here, trying to get through as many of these as I can here. So let me just, looks like a bilingual parent who's immigrant Chinese living in Spain now. Her SM 13-year-old child was born in Spain, speaks both Spanish and Mandarin well. Mom now has a dilemma whether to get support from this therapist who speaks Mandarin or a Spanish-speaking therapist. Mom feels that she can't communicate well with the Spanish-speaking therapist due to her limited Spanish. The child, however, is now attending a Spanish-English high school and is getting acquainted with English. So now looking at the possibility of the therapist gradually fading in his English teacher from school, who can then be the key worker to fade in other Spanish teacher. Any thoughts? That one is also in the chat because that's sort of complicated. So it sounds like mom and the therapist would be able to speak the same language, but not necessarily the same language as the teacher or as the teachers.
Yeah, that sounds challenging. I think getting a sense from the teen about, you know, what order is like her comfort level between those three languages would kind of get a sense of where to start with her. And obviously with a teen, you want to be very transparent about the ultimate goal and kind of working with the teen as to how can we get you most comfortable with, you know, being in this school that's going to require you speaking in English and Spanish, and what's kind of the best way to go about that for the teen. But yes, if it sounds like Mandarin would work well, then I think that idea of starting in Mandarin with the therapist and then kind of fading in maybe English with that therapist, and then hopefully that'll make the fade in with the teacher in English go a little more smoothly, to kind of smooth that transition between those three languages. It's definitely a lot to disentangle and kind of figure out what order is going to go best.
Yeah, I love that piece though about collaborating with the teen and having them help kind of guide that that decision-making process. Let's see. And I think the last thing was a more general question about social skills and enhancing any strategies to enhance peer interaction during recess. And that will be our last question, and we'll wrap up.
Wow. Oh, sorry.
I'm sorry.
Go
No,
ahead.
go
Nat.
ahead. Go ahead.
So I work with a primary elementary school. So we have peer buddy group during recess, although there is only 15 minutes because the kid, you know, now is the COVID, he doesn't want to stay after school. So all the training will put into the recess. So, but he also feel a little bit awkward if we really like ask him to come out from the classroom and to do treatment in another room. So we invite other classmates, 5 or 4 classmates, to play very simple game. It's called What Time Is It, Mr. Fox? So everyone just run and, you know, in fact, they have social skills, but they're just not feeling comfortable, you know, to speak up. So yeah, this is what I did in school during recess time.
A small group kind of
Small
facility.
group, like we started off with 3, but now we have extended to 6. He can really speak like 12 o'clock and everybody run and everybody's having fun, and he doesn't feel like awkward to be, you know, invited out from a classroom to do a treatment. Yeah.
Sounds like a great game.
Mm-hmm.
Love that.
Yes.
In my experience,
well,
just to add on shortly on that, children with selective mutism will need to have some person there that connects the child actively with another peer or with a group. Otherwise, they usually stand by themselves.
Yeah, so usually I'll kind of help join in or ask the teacher to help kind of pair someone's always like going to approach that child, say like, do you want to play, or like come play with me, to kind of help bridge that gap so that they feel a little comfortable kind of joining in with others. Help facilitate that.
Great. Well, I see we're at our end time. Thank you so much to Eileen and Sabine and Nelly, especially Nelly, because it's, I think, like 1 a.m. her time now in Hong Kong. So thank you for being awake for us. Thank you everybody for joining. Please look for the link to the recording, and please register for the next webinar. And again, thank you so much for attending and great participation. Thank you. Bye-bye.